Scenario-based multi-option choice questions are asked in ADC exams and overseas registration examination of the United Kingdom. Today, we will discuss a case that came to my office and will answer the question that will be asked in real part 1 as well as part 2 examination. I am Dr. Ajai Singh. I just want to say that this case discussion is for those who really want to understand secret behind passing the ADC examination. In this case presentation, we will do discussion as per new blueprint of the ADC exam. As you all know that in ADC exam, questions have been classified into 4 clusters. One, professionalism, which has been discussed in another lecture. You can view it by clicking at the link given in description. Second is clinical information gathering. Third cluster is diagnosis and management planning. Fourth cluster is clinical treatment and evaluation. We will discuss this case as per 4 clusters. Now the case discussion. A 62-year-old male presented himself with the complaint of inability to eat and chew properly. History revealed that he is taking medicines for hypertension and borderline diabetes mellitus. Otherwise, patient was healthy. On general examination, no lymphadenopathy or no ulcer were found in the mouth. Oral examination showed the picture as follows. Clinical examination showed this picture of lower right mandible and the intraoral periapical is showing the picture here presented. Question 1 belongs to cluster 2.1 clinical information gathering. The question is, based on the information rendered in the above 2 slides, providing the information about history and showing clinical and radiological features, the following or followings are the findings that we may be sure about. 1. Tooth 47 has a failed root treatment. 2. Tooth 46 has advanced decay leading to separation of both roots. 3. Severe attrition of tooth 46 led to the pulpal exposure. 4. Chronic periapical pathology associated with teeth 45, 46 and 47. 5. Visible part of the dental implant is showing normal picture. 6. Tooth 44 has no apical pathology. 7. Tooth 48 has impaction. Amongst above given answers, the correct option is A, B, C, D, E. I am not providing the answer here because we will discuss the case in coming slides as per new blueprint of the ADC examination. Only and only after discussion we will choose a correct answer. Remember, the same protocol will be followed in part 1 as well as the part 2 exam. In this slide, the signs are marked as per their sequence. Sequence number A are the symptoms that say that patient does not have pain, though he is having difficulty in mastication. Sequence B is indicating towards normal features of the buccal and lip mucosa. Sequence C is showing root stumps of tooth number 46. Sequence D is showing occlusal attrition of teeth 45 and 47. Sequence E is showing the signs of occlusal attrition and buccal abrasion. Sequence F is showing a dental implant replacing tooth 43 that I did in 1999 year. It has lost its superstructure. Sequence G is showing early bone loss around dental implant of around 2 mm dimension. Still we are in the zone of cluster 2, which is information gathering. The radiograph provided with the case shows A. Horizontal impaction of tooth number 48, B. Failed root treatment of tooth 47 with periapical abscess, C. Separated root stumps of tooth 46, D. Pulp exposure of 45 with periapical pathology, normal periapical region of 44, which is E, and F is normal peri-implant region. Gathering all the information, we will land up into cluster 3, which is diagnosis and management planning. Based on the information collected from history, clinical and radiological examination, we now can make differential diagnosis or confirm diagnosis. We shall start diagnosing as number 1, there is chronic alveolar abscess associated with teeth 46, 47 and 45. Number 2 diagnosis is horizontal impaction of tooth number 48. Number 3 diagnosis is decayed tooth number 46 with remaining root stumps. Number 4 diagnosis is occlusal adhesion of tooth number 45 with pulp exposure. Number 5 diagnosis is occlusal adhesion and buccal abrasion of tooth number 44. And number 6 diagnosis is healthy implant with no superstructure. After cluster 3, we will land up into cluster 4, which is the clinical treatment and evaluation. The treatments advised are extraction of 48 and 46, root canal treatment or extraction of 47, root canal treatment of 45, aesthetic restoration of 44, implant prosthesis replacing 43, superstructure, prosthesis for missing 45 and 46, and maintenance of oral hygiene. Here, one has to remember always that this is the proposed plan which will fall under the cluster 3. Once the patient gives consent to the full treatment plan, we shall commence the treatment. If the patient does not agree to the full treatment plan or agrees to partial plan due to financial or other constraint, it must be re-evaluated and modified. We present a case here as per the new blueprint of the ADC examination pattern. Find out the correct answer of a scenario-based multi-option single-choice question. We also showed you that how the Australian Dental Council wants you to think logically as per clusters of the question. By this method, one can answer questions in ADC Part 1 written examination. The Part 2 of the ADC examination, which checks the candidate's clinical understanding and technical efficiency, also work on the same pattern. We have created a huge pool of scenario-based multi-option single-choice questions for Part 1 written examination, which also prepares the candidate for viva voce in Part 2. We start preparing the candidates for Part 2 of the ADC examination while he or she enrolls for Part 1. For the clinical and technical part, we train the candidates once he or she passes the Part 1. Do join our courses and we will be thankful if you can like and subscribe our channel on YouTube and other places. One last suggestion to those dentists who call us or write us for making inquiry about ADC exam or course is that they should tell us their name, age, gender, graduation years, number of years of experience, marital status, number of years of experience, and number of children with their age, address, email, and mobile number to help them with a customized advice. Thank you.